with assessing victims. Now, I know that this first slide, we've already done that. So these are the things that we are talking about. Maria, will you turn at least one light off for us? Okay, we talked about what are you doing. These are the things that you do and the order that you do them. First, you recognize that it's an emergency. Then you got to check the scene. You already know this. And then you need to do that initial, which is that first assessment. Okay? So your initial assessment is just this, 3 steps. First, you're checking for life-threatening injuries, which is what? BBC. Breathing, bleeding, circulation, which means what? Heartbeat. A heartbeat. Those are your life-threatening injuries. Bleeding is not always, but we are looking for that profuse bleeding where either the blood is spurting or there's a cut or something where this person is going to bleed out very quickly if you don't get them help. Okay? You want to try and get a history. You want to try and find out what happened if you possibly can. Here's the only thing about this, and you might want to write this like in big letters somewhere. Basically, your initial assessment, the BB and C, you are usually dealing with somebody who's unconscious. So, or I should say unresponsive, not unconscious. Unresponsive. So you might want to write unresponsive victims somewhere where you've already written these notes, just out by the side or whatever. So you may not be able to get a history when you do this particularly, okay? Then you're going to perform a physical exam. And if you are checking for life-threatening injuries, because that person is unresponsive, you are checking for breathing by putting your ear to their mouth and nose to see if you can see or feel breath. You are checking for a pulse or heartbeat, and you're checking really quickly for any kind of profuse bleeding that may happen. While you're waiting for help, because you've already called 911, you're going to monitor for changes, because like we talked about yesterday, within seconds, things can go from bad to the worst possible scenario, and you're going to have to deal with that. That's the reason that you don't leave somebody. Okay? All right, so bottom line is now, how are we going to do this? What does this mean? All right, we already talked about this. Now I'm going to tell you how exactly to do it and show you how to do it, because this is the part that you will have to do for demonstration grade, is actually perform these steps on somebody. Now, first of all, you're going to check for unresponsiveness, not consciousness, responsiveness. So how do you think you're going to do that? How do you think that you're going to figure out if somebody is responsive or not? What were you going to say, Con?
Apply a little bit of pain.
You are going to apply a little bit of pain. What did you say, Con? Okay, where's your sternum, first of all?
It's your breastbone.
Yes, it is the breastbone right there. And if you push right there on your breastbone, there's very little meat between your skin and the bone. And basically what you're going to do, now you'll read some books and you will see some videos or some movies where people will, like even paramedics, will maybe approach the victim and shake them a little bit by the shoulder and say, "Are you all right? Are you all right? Hey, can you hear me? Can you wake up?" And the problem with shaking somebody, I'm not gonna say that you can't do that, but shaking somebody like that, what would be a problem with that, Devin?
If they have a spine or neck injury.
Yes. If they have a spine or a neck injury, that little bit of shaking could possibly cause further damage or even paralysis. So this is the whole deal about moving somebody if you're not sure. Because if you just come upon them, you don't know what kind of trauma they have to their back or their neck. So if you'll do a sternum rub, and you use your knuckles right there, and I'm going to show you how to do this in a minute. We're going to go through it all, and then I'm going to show you how to do the whole process. But if you'll use your knuckles right there, and you'll push really hard on the sternum, even when you do it on yourself, but you can do it harder on somebody else. You also have to consider this. When you're doing it on somebody else, your adrenaline's going to be pumping, because that's what happens. So sometimes you do have to be a little careful not to, even people who do CPR tend to do it sometimes, excessively, because you got that adrenaline pumping and you don't realize sometimes just how rough you can be. But if you do that on their sternum, I will tell you that can hurt enough that if they are about to be responsive, they're going to start probably swinging. What paramedics do, and I'll show you again how to do this, but they don't approach a victim from the side. Now, you may have to get on their side. Like if they're laying like this, you know that if you're going to do CPR, you're going to have to get on the side. To do breathing, you're going to have to get on their side. But I'm going to tell you that if you're going to do a sternum rub, you better approach them from the head and do a sternum rub like this. Do you know why?
The punch in.
Yes, they will. If they're about to come out of this because you've inflicted a little bit of pain on them, they're probably going to come up doing this if they can. And if you're on the side like this and you're doing it like this and their arm comes like this, they're going to go pow and knock you right out. So if you do it this way and you do it like this, you can block them if they come up swinging. Because it hurts. It really does hurt. When you do it hard on somebody's sternum, it hurts. Now, we're not going to do it hard when we practice. We're going to pretend. We're going to fake it a little bit. So you're going to check, first of all, for unresponsiveness. And here's the reason. If they don't react to that, then they are probably not going to react, period. They're not coming out of it. Because if you do that and they can react, they will. So the first thing you want to do, you don't just jump on them and start doing CPR or rescue breathing, because without checking that, they may already be doing those things. So, and if you do this and they become responsive, then you know they're breathing. You know? So you don't need to do all that other stuff. So this is where you have to check to see if they're going to come out of it, because you got two directions to go depending on whether or not they're responsive. Okay? If they lack normal breathing, that's the second thing you're going to check. Are they breathing? Because the one thing that we don't want to happen is for them to go without oxygen. Without oxygen, what's going to happen? They're going to have brain damage. So oxygen comes next. So you're going to check to see if they are lacking normal breathing. And that might mean that their breathing is excessively slow or excessively shallow or not at all. Okay? And then the next thing you're going to do is look for severe bleeding. Severe bleeding. If they've just got cuts on them, that's fine. They'll live. If it's spurting, or as I've said before, deep cuts where there is lots of blood, even if it's not spurting, but they are losing lots of blood. The more blood you lose, the closer you come to unconsciousness, the less oxygen you have to the brain. Now you got brain damage issues again. So you're going to check for severe bleeding. Okay? The entire assessment that we're about to do today should take less than 1 minute. So really and truly, think about it. All you're doing is checking for breathing, checking to make sure their heart is beating, and doing a quick scan to make sure that they're not breathing profusely. 1 minute. That's all it takes. It can't take longer than that, because if any of those three things are happening, you need to address it. If those things are not happening, then you have to move on to doing a second, what we call the secondary assessment. And we'll talk about that when the time comes. Less than a minute. Now, you do not move this victim when you're performing these three assessments. You don't move them. Now, the question is always, well, what if they're just lying on their back? They're just lying there on their back like we would wish they were? That would be great. But you know as well as I do, the chances of that happening, they may be on their side, they may be half on their side, and they could be twisted, they could be face down. If they're face down, how in the world are you going to figure out if they're breathing? You could get a pulse, but how are you going to figure out if they're breathing if they're face down on the sidewalk? That's an issue. And here I'm telling you, don't move them. Well, then how am I going to find out if they're breathing? Those are all things that we're going to talk about. But the bottom line is, there are some cases, and we've talked about them, that you can move them. So you don't move them unless, and this is the unless, you might circle it, number one, they face immediate danger if they're not moved. So where would that be? Fire? Where else? That they're going to be in danger if you don't move them. And where would they be? Okay, possibly in the car, but I got to tell you, sometimes they need to stay right where they are in the car. The only time you would want to get them out of the car and move them because they face danger would be what, Devin? Hang on. Quinn, I heard it over here. If they're in what? Possibly if you're in the middle of an intersection, but most of the time there are other cars that can see that. Okay, power lines? No, because if you power lines, you got to stay in that car until somebody comes to get you out. If gas is leaking and there's a possible explosion, you've got to get them out then. Okay? When else? When else would you need to move them in case, regardless, because they're in immediate danger?
In the water. Drowning.
Yes? Yeah? Or like if the car goes in the water, which we see that all the time on the news around here because we got so many ponds. People have a heart attack and they drive off into the pond, you know? Or they pass out from whatever and they drive off into the pond. Happens all the time around here. So yeah, if the car goes in the pond or if they fall, yes, those are all things. These are those: fire, explosives. They cannot be protected from hazards at the scene. Car's about to explode. One of the things that you did not say, but we've talked about it before, is they are in the middle of the road. Because all that goes back to immediate danger if they're not moved. But only then. Now, let me say this. If they go off the road and this is just an example, go off the road, hit a pole, hit a tree, whatever. There's no power lines necessarily involved, but you come up behind them and they're in the seatbelt, but they're not responding. Okay, so you're coming up to the car, they're still sitting in the seat. They may have blood on them. Probably the airbag has gone off. That in itself can be dangerous. I don't know if any of you have ever experienced that or not, but an airbag itself can be dangerous. But they are, hanging there on the seatbelt. Does that necessarily mean you need to grab them and pull them out? No, absolutely not. You actually can do pretty much all three assessments with them right there. The only problem is if you found something wrong, then you might, because you can't do CPR on somebody that's sitting in the seat of a car. So you may have to move them in a case like that. Okay? So any of those things, if you're unable to get to them, just like I said, that would be, again, if you recognize they're sitting in the seatbelt, you do a pulse, you realize that you can't give CPR, they're not breathing, they're not heart beating, and you need to get them out of the seatbelt and get them out of the car, then you can move them. Being very careful, I might add, about how you move them. We'll deal with that as well. Okay? So, you're only moving them in these cases if you cannot make the scene safe. And honestly, depending on what it is, you might not can make the scene safe. But you maybe can. So, for example, if it's a person who's having a seizure, can you do anything about a person having a seizure? No. The only thing you do to make that scene safe is what? Move everything out of the way. So they don't, because they will thrash and throw themselves around and possibly, hit their head. So you put something on their head, move everything around and stay right there with them. So in that case, you can make the scene safe. But obviously, if it's a car accident or, a drowning issue where they're being swept away in the tide and you think that, you're going to try to save them, even if you have a flotation device, you can't stop the tide from pulling them. If you can make the scene safe, great. If you cannot, then you can move them. Okay? Number 2, this is the second reason that you don't move them. You cannot give care because their location or position. Just like I just got through saying, if they're in the seat of the car, if they are drowning, you got to get them out. Obviously, you can't do CPR in the water. You can't stop bleeding. What would be another reason that you can't give care? I'm trying to think of other things.
So if they are face down, do you roll them?
Hang on, we're going to talk about that. Yes, but hang on, we'll talk about it. All right, so these are other reasons, so if they're in immediate danger, you can move them. If you cannot give them first aid, CPR, if you cannot do an assessment, you can move them. And then the third reason that you can move them, my bad, 2 reasons for moving them. I thought there was 3. All right, so checking for response. Let's see if this person is conscious and awake. Listen, if they are, that's the best case scenario. If you can talk to them and they can respond, even if all they're doing is blinking their eyes or nodding their head, if they're doing that, they are breathing and their heart is beating. Best case scenario, you would love it if those two things, they can, even if they can't talk, at least they're breathing and their heart is beating, and that's your biggest concern. Bleeding, you can deal with that. You can deal with that. Okay? So, ask them first, before you touch them, are you okay? And here's the thing. Remember that depending on what happened to them, hearing may be an issue. So, you don't just walk up to them and say, are you okay? You probably are going to have to yell it. You know? Are you okay? Don't shake the shoulder, the neck, the head. I will tell you that some books and some videos may tell you to do that. But most of the time, if they are out and you want to make sure whether or not they're responsive, just do that sternum rub. Okay? No response. If there's no response, that is a life-threatening situation. If you cannot get them to respond with anything that you do, it is life-threatening. By this point, you should be already at least dialing 911 if you cannot get them awake. And remember this, you need to get that process going before you start doing anything. Why? When I say that process, you need to get 911 on the way before you do any first aid. Why?
Well, they can tell you what to do.
No, well, that's one reason, but that's not the main reason. That's true, but that's not the real reason.
Because once you start, you can't stop.
There you go. Once you start, you cannot stop. You cannot stop. The only exception to that, I'm going to tell you the only exception, we haven't gotten there yet, but we will. The only exception to once you start, you can't stop, and you call first. If you have to do CPR on a child, you do the CPR, 2 rounds of CPR first. Then you call. With an adult, you call, then you do CPR. Because the chances are, with a child, you don't want them to, you want to start that immediately. And now, if there are 2 of you and one of you can call, the other one can start, yes. But if you're by yourself, you always give 2 rounds of CPR first, and then you call. You don't want that child to lack oxygen to the brain at all, if possible. That's the only exception to calling first. Okay, no response, life-threatening. Here's the thing. Now, there's this little scale that you're going to have to learn. There is actually a degree of responsiveness that will determine the situation. It is called the AVPU scale. And those all are, it's an acronym, AVPU. Each one of those things stand for something. And it is a scale that we use to determine how responsive this person is. You know, are they semi-responsive? Are they totally responsive? Are they totally unresponsive? These are the things that you use, okay? A stands for they are alert. They know the time, they know the date, they know their name, they know where they are, they know what happened. So A stands for how alert they are. Now, if you call 911 and they're going to ask you questions, you know that. First, they're going to tell you not to hang up. Second, they're going to tell you they've got somebody on the way. And then they're going to start asking you about the victim. Good thing about this is with our cell phone, something that's different Now, if you call from a landline, they automatically know your address. If you call from a cell phone, they can figure it out, but it's going to take them longer. The only good thing about the cell phone, not the only good thing, a good thing about the cell phone is you can put it on speaker. Lay the phone down, and then you can follow their instructions. But they're going to ask you, is this person, how alert are they? Are they, if you say, I can't get them awake, they're not responsive, I've done everything I know to do, but if you say their eyes are fluttering, or they can move their head, but that's all, or whatever, they're going to want to know that kind of thing. So they're going to ask you how alert they are. Your V stands for responding to verbal stimuli. Can they make sense? Can they hear you but not respond? So if you were to say to them, like if you try to talk to them and you say, what is your name? And they can't respond. Do you know what happened? They can't respond. But you say, can you hear me? If you can hear me, blink your eyes. You've seen movies where they do that. Or put your finger in their hand and say, if you can hear me, squeeze my finger. So how much they can respond to verbal. So you could tell them on when you call 911. They can't talk, they can't say anything, but I ask them if they understood and they blink their eyes. See, again, you have to remember, they're relaying all this message to the paramedics on the way, so the paramedics have some idea of what they're stepping into. That's what you want. So they may not make any sense, or they may be talking, but they are talking out of their head. If they've hit their head, or if they've had a stroke, or if they are they are diabetic, they may be talking out of their head and they don't even know what they're saying. That is a degree of verbal response as well. P stands for painful. Do they respond to painful stimuli? Not when spoken to, but to pain. That is your sternum rub. That's your sternum rub. Bottom line is, do they respond to pain? That's why sometimes you have to hurt them. Not hurt them like stab them, but a sternum rub will hurt, but it's not going to, you're not going to cut them or, anything. It's just going to hurt, and they should respond, hopefully. So U then is going to stand for unresponsive to everything. They're not responding to your sternum rub. They're not responding to your voice. They're not responding to anything that you do. So it's A, V, P, U. Alert, verbal, painful, unresponsive. You getting all this down, Anthony? You are? Okay. Okay? So that's the first issue, is the degree of responsiveness. Oh, to all stimuli. Sorry, added word. I bet none of this is what you expected in first aid, is it? I love it. Okay, so first is response. Now we got to check to see if they're breathing. What are we going to do? We're going to look for normal breathing. How are you going to look for normal breathing?
Listen.
But it says look, not listen, look.
Look for the stomach, go up and down.
The chest to go up and down, not the stomach. We don't breathe from our stomach, we breathe from our chest. So yes, you're going to look to see if the chest is going up and down. Here's the scary part about this is, again, like I said before, your adrenaline is going to be pumping. And sometimes even taking someone's pulse, you think you feel a pulse, but you know whose pulse you feel? Your own. Because your heart's beating so hard that you feel your own pulse and not theirs. So looking for breathing means that you've got to stop and calm your own self down for like 10 seconds to look and see if their chest is moving. And sometimes that's hard to do because of either where they are or if they got a big old sweatshirt on and they could be barely breathing, but you got that big sweatshirt or a coat on and you can't see it. So that's why we don't stop there. So you're going to look for normal breathing. Consider the fact that their airway could be blocked or even partially blocked. What could be blocking their airway? What? Food could be, if this is a choking incident. What else? What else, Josh?
Their tongue.
Yes. Their tongue could be blocking their airway. Now, can you swallow your tongue? You cannot swallow your tongue. I want you to feel of your mouth, not feel of it with your finger, but where's your tongue attached? On the bottom. Now tell me how you can, if it is attached where it is on the bottom, tell me how you're going to swallow that thing.
Cut it off.
You cannot swallow your tongue. However, with your head back, and if you were unresponsive and all your muscles relax, if your head is back, your tongue can fall back in the mouth and block the airway. But all you got to do is move the head forward. But there again, you got to be careful with that. Say it, Kyle.
But in the diagram, isn't it like you have your head, like your chin up and your head down?
But I'm going to show you the difference. You mean when you check somebody's breathing? But there's a difference in that. I'll show it to you. We'll do that in just a minute. Okay, so you have to consider when you're looking at the breathing that the reason is not that they can't breathe other than maybe something's just blocking their airway. Maybe they had something in their mouth at the time of impact, or it could be their tongue. So it could be just nothing but that. Okay? If they are unresponsive and lying on their back, yay. That's your best scenario right there. Is that if they're unresponsive and lying on the back, you don't have to worry about moving them. Because you don't want to have to move them. Because then that becomes a little bit scary. So you don't have, so in this case, you don't have to. So what are you going to do? You're going to do what we call a head tilt chin lift. And what that will do is that will move the tongue back away from the throat. When you tilt the head back and you lift the chin, it'll pull the tongue up away from the throat. You can't do it to yourself. You would have to see this in an unconscious victim. You can't see it, So that's, Kyle, is exactly what you were talking about. So if they're unresponsive to, remember, we're just checking breathing. So to get the tongue out of the way, you tilt the head back and you lift the chin up, and that pulls the tongue out of the airway, in case that's what's blocking it. Okay? If they're not on their back, here's the problem. They're not on their back. Then guess what? Don't move them immediately. Don't just grab them and roll them over. You can get down close enough, hopefully, that you can get down close enough to put your ear, like if they're on their side, and even if their face is partially down, get down there and see if they're breathing before you move them. Now, if they're flat down on the, face down, and you can't do that, actually you could put your finger up under their nose and see if they are. You could slip your hand up under their chest to see if you can feel the chest going up and down before you move them. Bottom line is you probably are going to have to roll them over, and we'll get there in a minute. Okay? So don't move them immediately. Look, listen, and feel. Get down there. Get your ear down there. Guys, you cannot do this stuff from a standing position. So when we start doing this on Monday, you're going to be on your hands and knees. There is no other way to do it. And you're going to be crawling around the victim. That's just how you're going to have to do it. So you're going to look, listen, and feel. You're going to put your ear close to their mouth and watch for the chest to rise and fall for 10 full seconds. Now, you think to yourself, that's not very long. 10 seconds will seem like an eternity to you when you're doing this. Why do you need to do it for at least 10 full seconds? Kyle?
Is the breathing slower than that? It'll take like 10 seconds for each breath.
Possibly. There's another reason as well. What did I say about when we talked about monitoring the victim? What? Right, because breathing can change very quickly. It can change very quickly. So 10 full seconds will give you the opportunity to see if they're breathing and then they stop, or they're not breathing and then they start. And it's going to seem like a really long time. Number 3, only if necessary, move the victim onto their back, keeping their head in line with the body. So I'm going to show you how to do that. It's hard to tell you, but the bottom line is you have to put both hands on the shoulders and kind of put their head in between your forearms and roll them all in one motion so that you don't move the neck. You can't just grab them and roll them over. There is a time when you can just grab them and roll them over, but we'll talk about that not now. You want to keep the head and neck in line with the rest of the body. Guys, let me just tell you how delicate a situation the whole neck thing can be. The paramedic who came and talked to my class, I think I told you a couple things that he said before. He was telling us about an incident where they responded to a car accident. And there was a woman who said they dealt with the whole situation, and she said that she was fine. She didn't want to go to the hospital, you know. And so, again, you sign a release form. Here's the thing. If you are coherent enough to say you don't want to go to the hospital, you can sign a form. So it's a refusal form. I refuse to go to the hospital. And that way, if something happens to you later, then paramedics cannot be held liable for anything that happens to you after that point. So she signed the waiver saying she wasn't going to go to the hospital. She went home, got in the shower, and when she went to wash her hair, put her hair back, and I guess she must have had long, thick hair, put her head back like that, her neck snapped just like that, and killed her because she had a fracture in her neck and did not just move just the right way until she put her head back like that, and the weight of her hair pulled it back and snapped that the vertebrae, the neck part that was already broken, and snapped her neck. This is the kind of thing, this is the reason that you go and let them check you out. It doesn't matter if they say there's nothing wrong with you, go home, then fine. But at least you know, had she gone and they did an MRI of her head and neck, they would have found that, and that would not have happened to her. So you go and let them check you out. Don't ever refuse. If the paramedics say you need to go, you go. And so what? If there's nothing wrong with you, what are they going to do? I mean, they'll send you home, fine. But again, that's how easily moving somebody with a neck injury can be fatal. So you have to be really careful. Here's the thing. You only really have to do that if the situation says there's a possibility that they have a neck or head injury. If it's not a situation, you know, let's say somebody just, like I've had before, has a seizure, and their head falls over on their desk. Is there any reason to believe that person's neck is broken or back? No. So you don't have to worry about moving that person. You grab them, get them out of the chair, and get them laying down on the floor gently. But you know she doesn't have a back injury. She just fainted over on the desk. So it depends on what happened to them as whether or not you have to be real careful with them. Just saying, so you know that. Okay? Number 4, if there is no breathing, then you need to start doing rescue brace and CPR. If they're not breathing, chances are their heart isn't beating. You need to go ahead and jump in there and start doing CPR. So, remember, if they're not breathing and their heart's not beating, what are they? They are dead. They are dead. Doing CPR, the chances are slim that their heart will start beating again. That's really not what CPR is for. It is just to keep oxygen flowing to the brain so they don't have brain damage. It's going to take an AED to start the heart back. Now, I will say this. There have been cases where people did CPR and their heart did start beating. That's great. But that's not the be-all, end-all to get a heart starting beating again, which was for a long time, people thought that if you did CPR, their heart would stop beating. And it won't. Not always. Okay? So you're going to start those rescue breaths. All right, so now you got to check for bleeding. Remember, we've already done breathing, responsiveness, and now we're looking for bleeding. And again, you're going to just do a quick scan of the body for obvious bleeding. Little cuts and gashes, you're not concerned about. You're concerned about soaking blood, pooling blood, spurting blood, obvious bleeding. You're looking for blood-stained clothes and under the body. Because if you've got them laying on their back and you're just looking at the front of them, they could have a knife or a gunshot wound in the back of their thigh. And they're bleeding on the bottom or on their back or the back of their head if they hit their head. So you've got to do not only a scan at the top, but you have to run your hands around under the bottom of them without moving them to see if there's blood on the bottom of them. Blood-soaked clothes as well. And then whatever bleeding that there may be, it's direct pressure. It's direct pressure. And we'll talk more about exactly how to do that when we do the unit on just bleeding. All right, so just wait, just stop right where you are because I want to show you just really quickly. Now all that took us